WLAE is presented by the Oxner Health System, a nonprofit academic multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Oxner Health System includes 8 hospitals and 38 health centers located throughout southeast Louisiana. Oxner, healthcare with peace of mind.
When Rose first started with us, she was just coming out of the hospital.
It's been a better situation. I can always depend upon her to help me. I'm home, and that makes me happy.
We're here to get her back into her routine and be able to live the life she wants to live. It's an honor to be trusted with that responsibility.
Good evening, I'm Tom Bagwell, and welcome to Hello Health, a partnership with WLAE, the Oxner Health System, and Humana to bring Oxner's Hello Health weekly education and information series to television. Tonight we're going to be talking about plastic surgery of the eye. Our guest is ophthalmologist Pria Sahu. In the second half hour of our program, we'll be taking your questions like we always do, live by phone at 504-866-3200. There's the number, 866-3200. We'll also be taking questions by email, and there's our email address, hhquestions@wlae.com. And some of you have already sent questions. We'll be getting to those in just a short while. Well, Dr. Sahu attended medical school at the University of Tennessee Health Sciences Center. He completed a transitional internship at Methodist Hospital in Memphis, Tennessee. He did his ophthalmology residency at Mount Sinai Hospital, that's in New York. His fellowship in oculofacial plastic surgery was completed at Azteca, the University of Southern California in Los Angeles. Dr. Sahu is board certified by the American Board of Ophthalmology, and it is our pleasure to welcome Dr. Pria Sahu to Hello Health. Good to have you with us on the program.
Thanks for having me.
Yeah, welcome you here and to New Orleans, because you've been here about a year now, right?
Absolutely, yeah.
Okay.
Moved last December. Yeah.
Good. Originally from Alabama.
That's right.
What is it that brought you, other than the chance to work at Oxner, to New Orleans, and what do you like about the city?
Well, I mean, New Orleans has so much to offer. There's so many things to do. I mean, just this past weekend, right? All-Star game, Mardi Gras, everything coming together. So
Yep.
a lot of different opportunities. And for what I do, I think New Orleans offers. There's a lot of the population, meaning we're so specialized. It's hard to, be. I think if you're in a smaller town, something like that.
Yeah.
New Orleans offers a nice population for sure.
We're going to get to your area of specialty in a moment and why you chose that. But what is it, do you remember what first interested you in medicine in a general way?
Well, I have to say my dad actually is a physician himself. He happens to be a urologist, and growing up in a medical family, it was always something I thought about, but it's something that I'm one of those people that I really have to want to do it myself. Mm-hmm. And when I did some volunteer work in college, and that's when I first realized that this is something that I would like to do, or I would consider doing. And it was when I was actually shadowing a retinal surgeon when I was a junior at Dartmouth that I realized that it would be great to be some type of surgeon, and then I had already had the ability to see, to shadow an ophthalmologist.
Now, let's talk about your area of ophthalmology and how you really developed this interest, because you're really a plastic surgeon of the eye, right?
Correct. I didn't even know this branch existed until I got to medical school. I had no idea that oculofacial plastic surgery was something that ophthalmologists even did. And when I was a medical student, during my ophthalmology rotation at the University of Tennessee in Memphis, I met Dr. James Fleming, who happened to be currently, he's one of the preceptors of oculofacial plastic surgery in Memphis and past president of our organization, ASOPers, which is American Society of Ophthalmic Plastic and Reconstructive Surgery. So when I started that ophthalmology rotation, we spent a couple of days with him, and that's when my interest really was sparked at that point.
That's the whole idea of rotation, kind of expose you to a bunch of different areas and figure out what you're going to enjoy most. Talk to me about how mentoring has played. There's one name, but I know there have been others, right?
Oh, absolutely. I would say my colleagues, throughout going through medical school, I mean, seeing them work really hard and get inspired, and they, went into ophthalmology. But I would say Dr. Murray Meltzer, when I was a resident at Mount Sinai Hospital in New York.
There's a picture of him. Right?
Yeah, absolutely. Yeah.
And what's going on here?
So we are at a museum for Genghis Khan, believe it or not, and that's why we're wearing the traditional Mongolian garb in that photograph. And so we dressed up, and we were there doing a medical mission in oculoplastic and reconstructive surgery. Basically, we'd spend about 10 to 12 days there. We'd fly in and then see about 100 patients over a couple of days, and then literally triage them. And then, because we only have a certain amount of surgical time that's there, and then we, just operate, 12 to 14 hours a day, and I think it's one of the most gratifying experiences doing that.
You said he taught you a lot about being a good doctor, but also about being a good person and about life. What was it about life that he taught you?
Well, every day his attitude was so positive. Every single day, no matter what was happening, what was going on, he always treated you with respect. He clearly had a zest for life. He enjoyed every single day, and he made it a point to really teach the people that he worked with, which was, at that time I was a resident, and he took the time to really do it, and you knew that he cared.
And just recently passed away, but I know his spirit lives with you, right?
Absolutely. He every single day, he still inspires me now, and I flew back, once I heard that he had passed, I flew back that weekend on a very short notice because he's given, so much to me and helped me throughout my entire career, or my short career so far, but yes.
Right. Well, let's talk about your practice and the common issues, sorts of things you would be addressing as in your area of specialty.
Oh, absolutely. One of the most common things would be excess eyelid skin or dermatochalasis. As the baby boomer generation is getting older, it's just everyone is going to get this as we age, or we lose collagen, our skin sags, as do other body parts. But especially the reason it's so important is it really affects your quality of life, or it can, impairing your vision. And I would say that's what patients really come in and saying, Doc, when I'm driving or when I'm watching TV, I feel that I have to, sometimes hold open my eyelids, or if I really crank up my forehead, then I feel that I can really see so much more clearly. And that's, one of the more common things that I see. The second thing would be something called ptosis, which ptosis and droopy eyelids can be similar. A lot of the time, the excess eyelid skin can cause the same thing. But ptosis means that the muscle that helps elevate the eyelid typically has slipped. And there are other reasons for ptosis as well, trauma, and there's some neurologic issues as well that can cause that. But in general, it's, once again, part of aging and eyelid rubbing and things like that, just constant trauma.
Eyelid cancers are something you would work with, right?
Absolutely.
With other doctors.
Absolutely. Eyelid cancers, typically basal cell and squamous cell carcinoma, sometimes melanoma, especially here in Louisiana, where there's a lot of sun exposure. People are outside working quite a bit. Eyelid cancers are definitely something that I see almost every single day in my practice.
What about bags under the eyes? That's something you're going to treat too, right?
Absolutely. And that the caveat is it's rare for that to be covered by insurance or anything like that, but absolutely the bags that people develop are hereditary, or sometimes from trauma or from other prior issues or systemic issues that are there.
Yeah. And tearing and wrinkles, and we'll talk about those two a little later in the program. Let's start with droopy eyelids. What causes them, and what can be done about them? How are they treated?
So droopy eyelids, like I was saying, there's several different reasons why you might have droopy eyelids. Usually it's the muscle has stretched. So the way I like to illustrate is we have a plate in our upper eyelid that has a muscle attached to it. So when we're younger, the muscle is directly on this plate, and as we age, the muscle slips a little bit. And that's the reason that you're able to still open your eye, and it's still working, but just not as effectively. Mm-hmm. And so there are different ways to treat that, and those are surgeries that you can do from the front of the eyelid or from the back of the eyelid.
And you brought along some pictures here, before and after, I would imagine. So let's look at these if we could.
Absolutely. So in this case, we see a lady who you can see that you can see her eyes, you can also see her brows a little elevated, but it's really hard to see most of the upper eyelid. You basically just see the skin hanging over. So this is called dermatochalasis, and some people would call it mechanical ptosis. So the skin is literally hanging over the eyelid, blocking the vision. And in this case, she's had just some skin removed, and I think she's had a little fat removed as well toward the nose. And that's something when we do this procedure, we remove a little fat, so it helps give a nice natural kind of contour. As we age, the fat pads that we see towards the middle protrude. And so when we do this procedure, I would say most occupational plastic surgeons would remove a little bit of fat from the middle, and it really gives a nice, even look.
Looks like two different people as I look at this picture.
Absolutely.
Yeah. Another example?
So this is another lady, as you can see that her excess eyelid skin, once again, is completely, in this case it's called hooding. So hooding is the terminology when the skin is hanging over the eyelashes themselves. And when you take a look here, once again, she has had just the skin removed, but it looks like you said, two completely different people. And this procedure takes about an hour to do, 45 minutes, something like that, and it can really change someone's life.
And in the third and final example?
So here, this is when I was talking about the muscle has slipped. And in this case, you can see the young woman on the left in the photograph, how she doesn't have a lot of excess skin, but the eyelid is droopy, correct? It's the droopy eyelid.
Looks tired.
Yeah. And the muscle has been advanced in that case to a proper height. Same thing on the lady on the left, a little asymmetric, but the left side actually looks fine, the left eye, but the right eyelid has become droopy, and a lot of times this is after cataract surgery. So if they've had, patients have had some prior eyelid surgery or even LASIK surgery, something like that where a lid speculum has been put into the eye, it can stretch the muscle that's there.
What are the tools you're going to use in these surgeries? And talk to me about the connection, if there is one, between excess eyelid skin and eyelid cancer.
Mm-hmm. So some of these are one of the basic trays that I use during eyelid surgery. What we can really expect is a little bit of bruising and swelling. A lot of my patients are on blood thinners, or they're taking aspirin, or they have arthritis. Excedrin, Aleve, Motrin, BC powder, Goody powder,
all over the counter.
They all have some type of blood thinning effect. So before surgery, I recommend, if they can, because cardiologists, obviously, if someone has atrial fibrillation or irregular heartbeat, something like that, we want to make sure. I always tell my patients, if your heart stops working, whatever I do up here really doesn't matter. So
yes.
we have to prioritize in that regard. But that's one of those things. And could you repeat again?
The eyelid cancer, any connection between excess skin, eyelid skin, and cancer?
Oh, sure. So in regard to the excess eyelid skin, that really doesn't have a relation with eyelid cancers. That being said, there are cancers in the orbit or the space behind the eye or even towards the brain that, because our nerves go through a very specific area, they kind of, it's like a pyramid, and the tip of the pyramid's behind the eye, and all our nerves come out through this pyramid. So if there's a tumor of the brain even behind the eye, and it compresses some of these nerves, it can cause the eyelid to droop. And that's actually one of those things that, just because the eyelid is droopy, doesn't mean the proper thing isn't to necessarily go in and raise it up, because you may be masking another problem. So you have to think about, you were asking me, what are other causes of that, neurologic causes of that, or even cancer. So there are certain autoimmune diseases, myasthenia gravis, for instance, that can cause ptosis, and you don't want to operate on those individuals until you know what they have, because then you're shooting at a moving target, essentially.
What can a patient expect after eyelid surgery? How soon before we see the after photo?
So I tell my patients basically it's going to be about a month to 6 weeks before you're going to be closer to your final outcome. There's always going to be some amount of scarring, and the skin is slowly changing. So that's up to a year. I mean, you're having the scar change, but mostly it takes about, like I said, 4 weeks to 6 weeks. But usually, even the day of surgery, sometimes they'll just have a little bit of bruising, but I say it's always going to be, you're going to have more bruising a couple days after, okay? And I recommend, using ice packs. Cold compresses really helps with the swelling and the pain, I think, as well.
Frozen peas, I hear, are very helpful.
Absolutely.
That's right.
Frozen peas, you can reuse them. They go back in the freezer.
That's right.
Cost effective, right?
There you go. Absolutely. What are the most common eyelid cancers? You referred to them, and how are those treated?
So the most common we know is basal cell carcinoma, and it typically affects light-skinned individuals, especially patients with red hair. And
thanks, Doc.
Yeah. So that's something that we definitely know, and we know a history of kind of blistering sunburns when we're younger, for whatever reason, can increase your risk of getting basal cell carcinoma. So that's the most common, and some signs of that would be loss of eyelashes, getting a new little bump on your lower eyelid. Those things are definitely risk factors.
What do we see in these next two pictures?
So here in this picture, we see a little diagram of if an individual came in to see me for a basal cell carcinoma, and I decided to remove it. And what we're looking at is a pentagonal wedge resection. And the idea is, how do we cut out that area, get the margins of the tumor, and then realign the eyelids, and how does it heal so that it looks like nothing ever happened? And if you take a look at the photograph there, especially for women and men too, in regard to eyelashes, we want to try to spare them if possible. So ideally it's a smooth contour, and the lashes are completely spared.
And in this final picture?
So here's a gentleman, he's actually a runner, and he came in with this rapid growth of this tumor, and this is called squamous cell carcinoma, once again related to sun exposure. Also systemic disease sometimes. Patients who have had kidney transplants or liver transplants or have a higher predisposition to getting some of these skin cancers.
This one I see, but any dermatologist is going to be able to pick that up. Anyone can pick that up. Right. We've got an issue here. But in some of the smaller ones, is just a typical visit to the dermatologist going to be able to pick up some of these smaller ones, especially in the one you started describing?
Oh yeah. The dermatologists are excellent at picking these up, and I work with some great dermatologists, and they, if they have any suspicion, they'll refer the patient to me, and I'm happy to do a biopsy. And sometimes they've just seen it so many times with their recognition. My sister happens to be a dermatologist, and she'll just tell me, she's like, I've seen it so many times I can just tell you. And right. So it's no, they're very good about doing that.
Let's talk about lower eyelid bags and what causes them and how those are treated.
Definitely. So as we get older, the bags, they're basically in a pocket. It's called the orbital septum, and it holds the bags back. And as we get older and our tissues loosen, the bags typically become more prominent, and that's why they come forward. And if you look at that photograph there, we typically have 3 bags in our lower eyelids and a couple of bags in our upper eyelids. And just as we age, and also with our weight changing, that they become more prominent, typically, yes.
And what happens when we just get tired and we wake up with bags under our eyes versus something that's usually get a good night's sleep, whatever the case is, things are going to look better and feel better. But when is surgery going to be an option, and exactly what are you looking for here in this next slide?
Well, They are, in regard to sleep, right? Sleep is, I think, critical. It helps the edema resolve. It just gives you, as you know, a nice look. When we get a full night's rest, all that edema is gone. But when we wake up and we have the bags, it's a temporary, for most people, it's a temporary fluid shift that's happening. So some people have even, some of my colleagues have recommended sometimes even to use a little bit of hemorrhoid cream on the lower eyelids, and what it'll do is vasoconstrict that area, meaning it causes the vasculature to really tighten up, and it makes the fluid go away. I mean, I'm not recommending that for everyday use, but something like that, and that's one of the ideas that are there. When you look at the lower eyelid bags, there's different ways to address them, and everyone has a different contour to their face. For some individuals, they just have a lot of protuberant fat, and for that, the traditional way of just removing fat will work for that patient. Other patients, they have a little valley, and so the light is drawn into that area, and for those patients, removing fat will actually make that worse. And so then you have to talk to the patient about, sometimes one of the things I do is fat repositioning, actually moving the fat around and kind of draping it over. And what that does is help smooth that valley that's there. Right. And for some patients, there's fillers. You can actually fill in that little valley with fillers, and to give that smooth little interface that's there. So each patient is truly different.
What do you find to be the most consistent cause of tearing in patients? And I'm assuming we're talking about excess tearing, not someone watching a movie that gets to them emotionally, right?
Right. So I think a lot of medications can cause tearing. So many of our patients are on several medications, and they all contribute something to tearing. And actually, they contribute, but they cause dryness. So it doesn't really make sense. But because their eyes are a little dry, it's a reflex system, and so tears are being stimulated. But a lot of the time, they aren't the proper consistency of tears. So it's just constant dryness and then tearing that's there. So in regard to just general tearing, I would say that's one of the most common causes.
Infection can be a cause, right?
Absolutely, infection. So in our ophthalmology terminology, there's something called epiphora, which means block, means tearing, but because it's not draining properly. And we have in our lacrimal system a sac that catches the tears, and then it drains into our nose, just like, so if you're crying, you feel your nose, you get tears in your nose, then it goes down your throat. So sometimes the sac can become infected, and that's it can actually get infected and become red, and you can actually have pus and discharge around the eye, and that's called dacry cystitis.
And what's happening with allergies in tearing?
Absolutely, allergies are just the chronic irritation. The inside lining of the eyelid is kind of getting jumping up. I would say jumping up, but kind of mounding up, and then every time you're blinking, you can imagine some patients even to the point of sandpaper feeling. Every time you're blinking, you can imagine that rubbing on your cornea is going to cause some irritation and stimulate tearing. That's there.
So if a patient does have a blockage and tears aren't draining the right way, how is that addressed?
So first of all, you have to figure out where exactly the blockage is. Sometimes it's just right at the opening called the punctum, or in the canaliculus, which is the passageway from the punctum to the lacrimal sac.
Yeah, and we have an image to show people right here.
And sometimes it's in the duct, which is from the sac into the nose. That's there. So there's several ways depending on where it is. Sometimes you can just open up the blockage. You can use a kind of a little roto-rooter to open up that area. But unfortunately, if the duct is blocked, which can happen, from chronic allergy, from previous surgery such as sinus surgery, or even cosmetic surgery such as rhinoplasty, something like that. If there's been a opening in the bone and in the duct itself, it can shut down. And so a lot of doctors we've tried to open up the duct or put in stents to really open up the duct, and we know that it fails most of the time, so we have to do a bypass surgery to bypass that area where it's really blocked.
Let's look at it with the nose too, and you can see the sinuses, what we're talking about here. Mm-hmm. Yeah.
So this is a great diagram here of the actual duct. So the sac is up near the eye, and then it actually exits right below the side here into the inferior meatus, which is one of the parts of within the nose. Yeah.
All right. And then you have a diagram of the surgery itself. Walk us through this if you could.
Right. So here is it's called DCR, stands for dacryocysterinostomy, which is a fancy name for creating a new passageway into the nose. Okay, so basically whatever is working at this point, which is your punctum and canaliculus, we preserve those and we use that to pass a little plastic tube, which is in the bottom diagram, which is illustrated black. And from what you can see in the top picture, the normal duct empties into the inferior meatus, which is at the very bottom. When we make a bypass passageway, we actually make a new passageway into the nose that ends up a little higher into the middle meatus. And that's typically where we like to make this new passageway to allow the free flowing of tears.
Okay. And where do you go in? Through the eye, through the nose? I would imagine through the nose, but
you can do both. There's an external DCR and there's also endoscopic DCR. And both have fairly high success rates, and it just depends on how you trained and what you're more comfortable with doing.
No scarring? If you go through the nose, there's no exterior scarring?
Correct. No exterior scar. That being said, even if the scar at 4 to 6 months is almost minimal, actually pretty much minimal in an external DCR as well.
And if that happens, that would be through the nose or through the eye?
For the external DCR is going to be on the outside.
Okay.
Yeah.
All right, very good. Our guest tonight is Dr. Pria Sahu, and tonight we are talking about problems with eyelids, eyelid cancers, and eyelid surgeries. We'll get to wrinkles in just a moment. But I want to invite you to call us with your questions about ophthalmology, and more particular, our discussion tonight about the eyelids. Our phone number, 504-866-3200. That's 866-3200. Or you can email questions to us too, as some of you have already done. And you can wait you can actually send the emails now or call now. hhquestions@wlae.com is our email address. Doctor, for people bothered by wrinkles, what can be done to ease the lines of the aging face?
So I would say that number one, getting a lot of rest, getting sleep. There are definitely things that we can do in regard to using toxin. Toxin is a botulinum toxin in particular to help freeze the muscles of the face, at least temporarily, and that helps with aiding the minimizing the wrinkles. Everyone's going to get wrinkles, but the question is, how do you make it look natural and minimize wrinkles? The other thing is you can also sometimes for deep wrinkles use fillers as well to help smoothen those areas. Absolutely.
And you brought a before and after picture here to show us as well.
Right. So here the forehead, you can tell that this young woman is really forcing hard in that second picture, but the forehead is completely without wrinkles. And that's one of the things that you can use with the botulinum toxin. There are several different types on the market that you can use, and for some patients, one type may work better versus others.
What about diet and its impact on the skin, and in particular the areas around the eye?
Oh, absolutely. I think staying well hydrated, eating a proper diet. When I say proper diet, I think a lot of fluid retention can happen if you're eating a high sodium diet. Even patients will come in and tell me that, I noticed that my bags were more prominent one day versus the other, and I'd be like, what did you have to eat? And they're like,
crawfish party.
Something
right?
Exactly.
Yeah.
So I think as long as you're thinking about what you're eating and you're really paying attention, you should be fine. And then obviously properly exercising, all these things together. Yeah.
Good. Well, we're ready to take your calls and questions and emails right now. Again, our phone number, 504-866-3200. That's 866-3200, area code 504. Or you can email questions to us at our email address, hhquestions@wlae.com. We'll be back with your questions in a moment. This is Hello Health on WLAE.
Now, I don't know about you, but for me, I really want to know where my food's coming from. You'll find the difference in flavor is quite remarkable.
The leaves are a lot more tender than the stalks and stems.
Absolutely. It's one of the easiest lamb recipes you'll ever try. It's avocado salsa turkey bacon burger. Make something delicious that you can share with friends and you can enjoy the flavor throughout the entire year.
Saturdays at 5 p.m. on WLAE.
Nightly Business Report. A new team, new editorial resources around the globe.
Chaos here continues. The same objective, insightful analysis of the top business news of the day.
For the Nightly Business Report, I'm John Ford.
Every weeknight, a half-hour wrap-up of complete market coverage.
With the business and economic stories that are crucial to you. Television's longest-running business program.
Nightly Business Report.
Weeknights at 5:30 p.m. on WLAE.
And welcome back to Hello Health. I'm Tom Bagwell. Tonight we're talking about plastic surgery of the eyelids with ophthalmologist Pria Sahu. And now let's go to your questions. And let's start with Manuel on line 1 calling us from Metairie this evening. Manuel, good evening and welcome to Hello Health.
Yes, sir, doctor. I was born with ptosis in one eye, and it was diagnosed as an undeveloped muscle. I've had 3 operations already, which were a failure. All they did was open the eyelid, but it doesn't allow it to function like a normal eye. I was wondering if I've reached the end of my rope, or if there's any further situation that can be done.
Manuel, that's a great question. Sorry that you've been through 3 different operations. Congenital ptosis and the issue that you have is actually, it's a very difficult condition to treat. And the fact that it's one of those things is the muscle, it becomes fibrotic. And so once you elevate the muscle, sometimes it's stuck there, but it's very important that you're able to close the eye. If once you've elevated the muscle once, then it's probably going to stay up a little while, but the muscle also over time will loosen. Now the question is, once you've had 3 operations, then every time you go back in, you're causing more scarring and more trauma to this muscle. I think it's reasonable. It depends on how much it really bothers you, and how much it is really affecting you in your day-to-day life. 3 operations is a lot, and so I'm sure that the people who operated on you gave it their best effort. But definitely there are ways to reoperate again, but it has to be looked at carefully before proceeding. And
Manuel, you mentioned lost eye. Already gone. Okay, Manuel, thank you for your call. I appreciate it. Our phone number is 504-866-3200. That's 866-3200, and we do have lines open for your questions tonight. We have gotten some emails, and let's go to those now. Doctor, I'm 62 years old and recently have been diagnosed with macular degeneration, the wet kind, behind my left eye. We're going to ask you to talk about macular degeneration because we haven't talked about that tonight. Can you please tell me if this would interfere in my interest of having a future droopy eyelid procedure? Thanks for your help. This is from Phyllis. So Phyllis, thank you for your question. And let's start with macular degeneration, the wet and the dry kind, and then we'll get to Phyllis's question.
Sure. Macular degeneration is one of the most common retinal diseases, at least here in the United States. Affects millions of people, I would say, and the wet and dry kind. So what are we worried about? In the dry kind, we're getting atrophy of the retina at the back of the eye, and in a way, sometimes that disease process over time can significantly affect vision. The wet kind basically means these new blood vessels have formed, and typically in the center of the vision, and they cause scarring and contracture and really can warp the vision. But luckily, over the last 15, 20 years, we have these anti-VEGF products, which are actually injections into the eye that can now be given. So if it's caught in an early manner, then these injections can be given to the eye, into the eye, and help prevent the progression of the disease typically. Having macular degeneration, even the wet kind, and then having surgery, it should not preclude one from having surgery. That being said, it really needs to be followed up. It's one of these diseases that will continue to progress if it's not monitored. And definitely the wet kind can be vision threatening, and the other eye should also be monitored as well, because once you've had a transition from dry to wet, then there's a higher risk of the other eye changing over to wet.
And what about Phyllis's question of she's had I think she said the wet kind. Did she say the wet kind? Or
yes.
The wet kind.
Yeah.
How would that impact her ability to have the surgery for droopy eyelids? Or would it?
It really would not. It really would not impact the surgery at all. So if she has the droopy eyelid now, she should go ahead and have it evaluated for sure.
All right. Phyllis, thank you so much for your email question tonight. Our phone number, 504-866-3200. That's 866-3200. And again, we do have phone lines open. Let's go to another email question. Doctor, I have a question about what can be done about eye circles, surgery, or other treatment. Dermatologists say it's hereditary. And what are eye circles? We talk about, again, lines under the eye?
Right. So part of it is, like I was saying, that as we get older, the fat has kind of protruded forward, but each patient is different. And the circles, there's definite differences in how those circles can present, meaning if there are circles such as there's a valley, there's a deficit, and then you need to kind of build up that valley, or is it just like a mountain kind of hanging over from the side? And that's something where you need to, you can address surgically. So there's a lot of options there surgically with the fillers, and the other thing is, watching your systemic health. If you have kidney disease or you have heart failure, all these things, you can retain fluid, and that can definitely affect the appearance of circles.
Does science tell us that there is a heredity factor in all of this?
I think that just from kind of anecdotal experience, and I have patients and they said, oh, my grandmother has the bags, my mom has the bags, and no, I have the bags. So I definitely think but it makes sense that it's part of the genetic makeup of just the build up of the face, how their natural contour is there.
Right. Okay, let's go to our phone lines. Line 1, Tracy's been nice enough to hold for us. Tracy calling us from Metairie this evening. Tracy, you're on with Dr. Pria Sahu. Welcome.
Hi, thank you. I actually have two questions. The first is, I was wondering, what is the recuperation time for the eyelid lift? And then also wondering if it can improve my vision as well.
Thank you, Tracy.
Oh, great question. So the recuperation time typically is about 1 to 2 weeks. It depends on how extensive the eyelid lift is. I always say you're going to be black and blue for a couple of weeks. Obviously, once again, it depends on if you're on blood thinners, if you've held aspirin, held your warfarin and Plavix, and all these other things that are there. That's typically what I would say. Some patients come back a week later. It doesn't even look like they've had any type of surgery the week before, because it's their natural predisposition that they don't really bruise or swell that much. And in regard to the eyelid lift, yes, the eyelid lift is one of the most commonly performed procedures, I would say, mechanical ptosis repair, and it helps your superior visual field. So it really opens up your entire superior visual field, or looking up, whatever it is that you're doing, reading, driving, anything like that. So absolutely, if a lift is done properly, then it should help you improve your superior visual field.
All right. Thank you for your question, Tracy. Good hope. And are these tests that can be done in the office? Because I have no idea whether I can look up and see, right, but I have no idea what's being blocked, because it probably happens slowly and over time,
Correct,
right?
Correct. So all these visual field tests are done in the office. It takes about 10-15 minutes, and it's typically done at the visit when you come in. And if for some reason it can't be done, then we can schedule it where you can come in even before seeing the physician. Absolutely.
Very good. Our phone number again is 504-866-3200. That's 504-866-3200. Our guest tonight is ophthalmologist Pria Sahu. And now another email question we've received. Doctor, will insurance cover the costs of droopy eye surgery? And then we can talk about some of the other surgeries we've talked about tonight.
Sure. The droopy, there are certain parameters that insurance companies have, and if you qualify, we do a test, the visual field test, and literally you come in, we have you relax, and you do the test in which you focus on one object, and then you should see some lights come here, 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 here. And if you see those lights, you click. And so it gives us a baseline. So we have you really relax and take that test. And then the eyelids themselves are taped up, which would simulate having the surgery. And once again, the test is performed, so you can actually see a difference of where you can see the lights and where you can't. And once we have that information, then I can say we submit it to the insurance. And there are certain parameters that are there, but ultimately, sometimes there are parameters that just from your clinical exam can make it that insurance will cover it for sure.
In general, would you say if your sight is impacted, and obviously health is impacted, more than likely covered? If it's just I've got bags under my eyes or darkness under my eyes, more than likely probably not.
Correct. For the lower eyelids,
in general,
yes, the lower eyelids are almost always considered a cosmetic expense, or are just considered cosmetic because it'd be rare to have the bags so big that they come up to impair your vision.
Right. Yeah. Very good. Our phone number again, 866-3200, 866-3200. We do have lines open and time for your phone calls tonight. In the meantime, here's another email. I'm 88 years old and had cataract surgery. Since then, I've had droopy lids. I've also experienced double vision. Could the droopy lids be contributing to the double vision?
Good question again. Anytime we have to we evaluate the droopy eyelids, there are neurologic problems such as myasthenia gravis, which is an autoimmune disease that can affect not only the eyelids, but also can affect the eye muscles. So there are a couple of things that we have to consider about double vision. One of them is the double vision completely separate? Are you seeing two separate images, or is it overlapping? And typically, if it's overlapping, it may mean that you need to get a new pair of glasses, meaning that the power in the glasses is not as good as it can be. Okay, and then, but if you're having the droopy eyelids, that in and of itself should not cause double vision. And actually, if one eyelid is closed, then typically you're just looking out of one eye, in which case it'll be very difficult to have any type of double vision.
Okay. Our phone number again, 504-866-3200. That's 504-866-3200. You talked about changing the look of the eye, and we saw that in some of the examples you brought along tonight. And if I'm not mistaken, I think I read most eyes are about the same size, right?
Correct.
If you took the eyeball out, they're all about the same size.
Yeah.
The difference is how much skin is covering the eye.
Right.
You'll remember back to your Disney days, when you were a kid, and all the Disney princesses and most Disney characters have those huge eyes. So the eyes themselves aren't larger, it's just we see more of the eyes. In this day of cosmetic surgery for almost everything, is this a request you're seeing, or is this a request that some of your colleagues are seeing? Make me look like a Disney prince or a Disney princess.
So luckily, so far, I haven't had that request here, and but I think it's definitely something that's there, and you have to really take that in stride of in counseling the patient and talking to them about why they want to have it done. What is the goal of having that appearance of looking like a Disney princess? So I think as long as they are aware of what it's going to take and what it entails, and why they're doing it, then I think you might consider doing it.
But you said there'd be some mechanical issues too, right? If you
yeah.
removed enough of the skin, you might not even be able to close your eye,
Exactly.
right? So it's not as simple as make me look like Belle or whatever the case would be. Right.
Number one is when you're operating, you want to make sure that the eye can function as it should function. And we were discussing earlier, yes, you can open up the eyes and make them huge, but if you can't close the eyes, then you're creating a multitude of other problems that are out there.
Yep. All right. 866-3200 is our number, 866-3200. Rebecca has been calling us from Metairie this evening. Rebecca, you're on line 1 and you're on Hello Health.
Hi, I am 44 years old and I have really dark circles under my eyes that I've always had. Is there anything that can be done to improve that?
So I have to ask, is this something, your systemic health? Do you have any health issues?
I think really I've always had them, so I think it's probably genetic. But is there anything that can be done but there's no health issue that makes them happen?
That can contribute. Okay. Well, so it depends. Some patients, there are some bleaching creams that are out there. Some dermatologists have recommended using something like hydroxyquinone, a bleaching cream that can, decrease the darkness that's there. You have to be careful because then you don't want to make it too light, and then you're drawing attention to that particular area. I'm not obviously your skin color and texture. All these things do contribute, and you want to be careful before doing something like that. But that's definitely an option for sure.
Rebecca, thank you so much for your call this evening. We appreciate it. 866-3200 is our phone number. Let's go to line 2. Janella is calling us from Miro this evening. Janella, welcome. You're on with Dr. Sahu.
Yes, sir. My name, that's not what I wanted to say. I have excessive tearing in the eyes, both eyes, more the left, the right side. And I'd like to know, are you the type of doctor that can take care of this?
Absolutely. Absolutely, Janella. When you come in to see me or another oculofacial plastic surgery specialist, we typically run a couple of tests. Sometimes we flush some fluid through the tear drainage system and to see where the blockage is. And that's what we do day in and day out. So absolutely.
Okay, great. And that's where she would start, with a specialist. Yeah. Okay, good. Thank you so much, Janella. We appreciate it. Good luck. Line 3, Claude is calling us from Metairie this evening. Claude, welcome. You're on Hello Health.
Thank you. Good evening, doctor. I have little eye tags on my upper eyelid. I'm 86 and healthy as a horse, but getting a little lame.
What advice would you have for skin tags on the eyelid? Is this something that you deal with?
Oh, absolutely. Skin tags, patients come in every other day for skin tags, and it's something typically, if it's really irritating you and bothering you, that we can address in the clinic. Typically have a minor procedure day, and I have several patients who come in that day, and we remove the skin tags if it's really irritating you and bothering you, for sure.
And skin tags, would that be considered cosmetic surgery, probably not covered by insurance?
It depends. It depends on what type of lesion is there. Sometimes skin tags, they can be similar to something like aging spots, which is seborrheic keratosis, just a fancy name for these stuck-on lesions that are there on the eyelid, and Medicare will cover that. So until the evaluation will let you know typically. Yeah.
Okay, good. Claude, thank you for your call tonight. We appreciate it. Let's go to line 4 in Kenner, where Amy is holding. Amy, you're on with Dr. Sahu. Welcome. Amy, are you there?
Oh, yes.
Oh, go right ahead, Amy.
Okay, I have a two-part question. First question, would I be a candidate for an upper and lower eyelid if I have really bad allergies wherein my eyes get really swollen? And do you recommend having the recovery period for both upper and lower? Should I just go ahead and do it all at once, or do one then the other later?
So I would, for in regard to should you do it all at once if you're considering it, then I would say yes. And the reason for that is if you're going to go under anesthesia, then it's safer to just go under anesthesia once. In regard to the allergies and causing the lower eyelid bags, over time it can, but a lot of that is fluid that has actually that has stayed there. So when I do cosmetic surgery on patients who have chronic allergy, I counsel them that this is going to help you, but it's not going to completely make it go away. And so that's something I think you need to understand. And the recovery period, if you're doing the upper and lower, should be the same for as if you were just doing the upper. It's really not going to change that much. There are variations in if you're going to do the lower lid on how it's done that can cause some edema.
And you said some people heal quick just by nature. Some people heal quicker than others,
Oh, yeah, absolutely.
bruise more than others. And when you say a week or two, you're talking about being out of the office a week or two, not just not going out on a date. You're talking about being out of service and not at work for at least a week or so.
You know,
think?
I think, and that's a great question because everyone has they do different things. So I have patients who are in the office all day long, and I say, you know, you're going to be bruised and swollen, but you can wear sunglasses and go back to work in a couple of days. You really can. And then I have patients who, you know, work as a machinist, and they're in a, you know, really dusty environment, and, you know, you don't want the wound to get infected. So for a patient, depending on where they're working and what they're doing, there are different parameters that I discuss with them in that regard. But I think if you're, you know, in the office in a fairly clean area, then you really can go back in 3 to 4 days. You're just going to be bruised and swollen, but you can put on some sunglasses.
Are the eyes themselves extra sensitive to light after a surgery such as the ones you're talking about?
No, not extra sensitive. The vision may be a little off, and it's because the swelling of the eyelids pushes on the cornea, which refracts a lot of the light. So, but the vision, I mean, it's not like you can't see your hand, or you know, you can't watch TV or anything like that. It's just a little off.
Right.
Yeah, as the eyelids are edematous. Yeah.
Okay. Let's go back to our phone lines. Calling us from New Orleans East this evening is Raymond. Raymond, you're on line 1, and you're on with Dr. Pria Sahu. Welcome. Good to have you with us.
Thank you. And thank you. Doctor, my question is, I'm about to have cataract surgery, and I'm kind of nervous, and I want to ask you, everybody's saying that it take an hour, some saying, then the YouTube say a 6-minute surgery, then another person told me it was an hour. I just need some advice from you. Okay, thank you.
Thank you, Raymond. Put him at ease, would you? I've seen a 6-minute cataract surgery. Not that they all go 6 minutes, but go right ahead.
Raymond, I think you've all those answers are actually correct answers, and it depends on the physician who's doing the cataract surgery. Absolutely, there are physicians out there who do a 6-minute cataract surgery. There are physicians out there who do a 1-hour cataract surgery, and it really varies on just how they've trained and how comfortable they are proceeding. That being said, the cataract surgery, if I'm not mistaken, is the most commonly performed surgery in the United States. So rest assured that whoever's doing the surgery, I'm sure, has done quite a few and will do a good job. But there's definitely variation in surgical timing,
all right,
for sure.
Raymond, thank you so much for your question, and we hope that puts you at ease a little bit. Line 2, Alice is our final caller this evening. Alice is calling us from Gretna tonight. Alice, you're our final guest with Dr. Sahu. Welcome.
Hi, thanks for taking my call. I am 77 years old. For a few years now, I've been told to have a cornea transplant. I am deathly afraid. Do you recommend that?
So it depends on, there are several factors that this depends on. The reason, you know, why are they recommending the corneal transplant? How well are you seeing in the eye? And how well are you seeing out of the other eye? All these things have to be considered before proceeding. I think a corneal transplant is a great option for patients who truly have impairment in their vision. The technologies have really changed even in the last 10 years on how we do the surgery, and I think it's definitely a good option. Depending on, obviously it depends on you. You know, if the proper person is doing it, and I think it's going to really help you see better, then I would say definitely I would consider it for sure.
It's a quality of life question.
Yes,
too.
Absolutely.
Yeah. Great. Alice, thank you so much for your call this evening, and thanks to all of our callers. Some terrific questions tonight, and thanks to Dr. Pria Sahu for being with us this evening and for making his investment by being in our city of New Orleans. Thank you so much.
Thank you for having me.
Good to have you with us, Doc. Well, to make an appointment with any Ochsner physician, including tonight's guest, or to register for any of Ochsner's Hello Health seminars, you can call Ochsner at a number set up just for viewers of this program, and there it is, 504-842-5669. That's 842-5669. As a reminder, you can rewatch tonight's presentation or any of our Hello Health programs on our website at WLAE.com or on Ochsner's website at ochsner.org. Our thanks again to tonight's guest. Thanks to Humana and Ochsner for making our program possible. And our final thanks, as always, is reserved for you, for your support of our program, Hello Health, and our station, WLAE.
Hello Health on LAE is presented by the Ochsner Health System, a nonprofit academic multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 8 hospitals and 38 health centers located throughout southeast Louisiana. Ochsner, healthcare with peace of mind.
When Rose first started with us, she was just coming out of the hospital.
It's been a better situation. I can always depend upon her to help me. I'm home, and that makes me happy.
We're here to get her back into her routine and be able to live the life she wants to live. It's an honor to be trusted with that responsibility.